Welcome to Integrity Overscale podcast. My name is Layli, your host for today, and I have Chris Clark here with me. Chris, thank you for joining us today.
Thanks for having me.
I'm really excited. It's actually an interview that I've been wanting to do for a very long time, and one of the reasons being that you have been in the medical field for a very long time, and we can talk about what that means in a second. But you've had 23 years of experience as an associate vice president with, I think, Doctors Company, if I got that correctly.
Yep.
Yeah. And you've been retired now and have been part of a community giving back, which has been so, I admire it from afar. So I'm really excited to have you here all together because you also have some experience, which we will not name the company, for 3 years, where you notice maybe not narcissist, but hubristic behaviors with the leadership position. And you said it was a professional, what was it, liability type of company?
Yeah, professional. We insured hospitals, doctors, and facilities across the country.
And I'd love to learn more about anything I haven't said that's wonderful about you. Do you have anything else to add that I haven't added today?
Well, probably, but I taught school, which actually became pretty important when I was becoming a salesperson and actually a manager. Because as a teacher, I taught for 4 years in middle school, and I looked at the clients and the people I worked with, mostly as students. So I approached what I did career wise as education, which really changed the lens for me.
Mm-hmm.
When you're thinking about these all really super smart people. I mean, doctors, CEOs, CFOs, you know, all sorts of credentials, and they really didn't know anything about professional liability. So when I approached it that way, it took the temperature way down for me personally, because I clearly wasn't the smartest guy in the room.
Yeah.
But on one subject, I was.
Well, for listeners who don't know what professional liability is, can you just give us a little bit of summary of it?
Oh yeah, sure. It's malpractice insurance. So something goes wrong, we defend a doctor or settle a case. And sometimes it's big money, sometimes it's not big money.
Mm-hmm. So I want to go back to your career, your experiences a little bit with you, if that's okay.
Sure.
So as I'm looking or reflecting with you, based on the experiences that you've had, what would you say shaped you as a leader?
I was super fortunate. The CEO of the company before we got bought by the doctor's company was my mentor, and he was a really good mentor. And he liked me, and which is I was grateful for that too. But I was very fortunate to have a very good example of a very good business leader, maybe low on the human relation side. And I think that's the reason he liked me, because he could count on me to give a pulse of what was really happening in the company. Because as a CEO, people wouldn't tell him. And I was naive enough not to know to be intimidated by it.
Mm-hmm.
So if you want to know, hey, what's the feeling in the building? We'd be having a talk. So that was good.
You were more likely to give him the truth, is what I'm
I
understanding.
would give him the truth because I didn't really, and we can talk about the reason I was able to give him the truth later. But uh, it it was a very good relationship for the most part. I was very fortunate. I look at from a business standpoint, he was a genius, and from a feel, empathy, intuition point, I was I was his guy.
Mm-hmm. Mm-hmm. So if you were to say I have maybe these traits that I have as a leader, what would those be named? One, I would think you would be a truth teller. What would be the other two?
I think to be a good leader, you got to have a high empathy factor, um, and I got better at that. Um, I really, and it's something you can't really put data points to, but I went a lot on intuition and feeling, and it worked with clients. It worked in the company. Uh, and that's not for everyone. You know, a lot of very good managers can have data points and all sorts of information and spreadsheets and pivot sheets and all that stuff that you do in the business world. But I really relied on my gut. It really bothered the CEO.
Yeah.
Because we'd look at an account and we'd spend 40 to 50 hours of underwriting time to get a quote out. And I'd say, oh, yeah, I think it's worth about this. And then I would be within, I don't know, $10,000 or $12,000. And it's like, how did you do that? It's like, I just felt well like that. That's a hard thing to quantify.
Yeah. Anyway. That's amazing. I love that you talked about guts because some of us, I would imagine, would be a little scared of the gut parts. Um, can you tell me a little bit more about what it sounded like as it like hits? Was it more some? Did you trust it 100%? Was it ever wrong? Just anything about that gut.
Either I was very lucky. Uh, I I really relied on it. That was and I could do all the math and all this stuff that you do as a VP, and but I really, and this might, I don't want to sound like a total egotist, but so like I felt like I could walk into it because we insure doctors. It's sometimes it can be a significant amount of money. Sometimes it's not. But I felt like I could walk into an office and within about 15 seconds tell if this was a place we should insure or not.
Really? What were some of the giveaways? I want to know. What did that gut sound
How
like?
you greet it,
Uh-huh.
the condition of whatever situation you're in. It's it, boy, it's. I mean, we spent tons of money on underwriting. We even employed a bunch of them, and it was like, no, this is a bad risk. We shouldn't do this.
Yeah. Well, speaking
so
of yeah.
Anyway.
Well, speaking of the field part, because you mentioned, the industry. So you dealt with doctors, I'm sure patients, regulators, all over that. Is there something that within this industry that you would say people don't understand walking into it that you do, knowing this for 25 plus years?
It's I could make it sound really mysterious, but
Yeah.
it was really funny. We were having a management meeting, and you might edit this. You might
Never.
edit the whole thing.
Never.
But it was so funny because we had another VP in there. It was going on, and then the CEO finally said, Larry, the goal is to take more in premium than you pay out in claims. And it's like, that's about how simple it is. I mean, we overcomplicate it and we can make it super confusing, but it's really not that confusing. Um, I could go on about how I never looked at what we did, even though we were the largest malpractice carrier in the country. I never looked at what we did as essential, other than doctors must have hospital privileges. I always, when people ask me what you did, if I could make some big statement about I'm all this and that and director in the company and all that, or I could say the truth and just say I'm a bottom feeder. A step up from a detail guy, pharmaceutical person. We don't add any value. I mean, we tried because we did great risk management programs and we did medical office evaluations to sort of self-interest, but we'd go into an office at no charge and evaluate the entire medical system, EMR, all of the stuff, and come back with suggestions for them. And it was all voluntary. It wasn't like, oh, you're going to do this, that, and that. Because if we did that, that would likely mean we would not, if it was to the level of like wow, you're doing some bad stuff here. We'd go through the process and try to help them find a safe landing, but it wasn't us.
The ones that you did insure that did come through, what were some painful points that you saw for the doctors that you dealt with that you would be open to talk about?
Oh, sure. The whole credentialing piece for physicians is, in my opinion, ludicrous.
Mm-hmm.
It's expensive, it's slow, and it's basically unnecessary.
Mm-hmm.
And I felt like doctors gave up control of their practices, which is now going at 100 miles per hour, when they succumb to allowing others to credential. Because there was a point in the 90s where they could have said no, in my opinion. I know that the credentialing people from health insurance companies and hospitals and all that think they're really doing a great service, and we need to find out which beautiful medical school these guys went to and what was their employment record for every second of their life. But it adds nothing. To me, if a malpractice insurance carrier is willing to spend $5 million or whatever in risk to insure, what more do you need? It, it's very simple. And so, of course, it can never be done now because the cat's already out of the bag. Because these people actually think they add value to the system, and all they do is add cost. And it's really, that's actually part of the reason I retired. Mm-hmm. Because it's just, I used to meet with doctors, and then it became I met with C-suite people, and that's when it started to change. So then the industry became more about money than relationships, and I was big on relationships. You probably figured that out. I was big on relationships and really didn't care about the money, because you can kind of, from a premium standpoint, you can make it whatever you want. It's really about what the risk you would take. I mean, you can insure a doctor for dying and make money, or you can insure a doctor for millions of dollars and lose. I mean, sorry,
No,
kind of went down the rabbit hole on that. Sorry, lately.
I appreciate your honesty, especially because if that's what led you to retirement, that's, I think, amazing for any listener to hear, because some of us have been in jobs where we've gotten burnt out, and it has to do more about becoming more of a transactional part of the organization rather than the transformational part of the organization. So I'm pretty sure a lot of people can relate to you on that.
And when it stopped being fun, then why do it? it I'd rather deliver Meals on Wheels than do a job that's just like, rather grind your teeth and go to work. I mean, that's not a healthy place to live.
Speaking of healthy place to live, we know how medical field is so regulated, and we also, from a sales perspective, it's just so driven with metrics and measurements. How did you work with your team to keep them motivated and keep them where they needed to be in a world like that where money was the focal point?
I might not answer this right. the I I never, when we had meetings with my team, I never focused on the money or production. I I felt like I was a real high relationship guy. So I was more about volume of contacts and quality of contact. I'm sorry, I think I'm old, and B, I'm not answering the question. So could you rephrase the question?
I feel like you are. I really do. You said you cared about the quality and volume, and my main question is more about how you keep that a team motivated where it's very metric driven.
Well, I did it by example because I really didn't.
Yeah.
I was in a very fortunate spot where the expectations were pretty low for me, but my expectations for myself were out of this world. So I never worried about numbers because I knew I was going to get numbers. It wasn't about numbers. It was about the relationship. And I think people, when I did that, when I would do that to a client, they would know that I actually cared about it. I mean, I insured one of the largest groups in Los Angeles because there were two doctors that owned, and I didn't know it. I could name their names, but I won't because they probably want to protect themselves. But they owned, God, they owned part of, well, they're in White Memorial Medical System and the Adventist system down in Los Angeles. And they're just two doctors. So I met with these guys and we talked and they told me, you're telling me the truth, aren't you? And I said, yeah. You know, I mean, I looked right, I had a suit and tie and slicked hair and probably wore cologne. And yeah. And so from these two doctors, it was a total of $12,000 in premium a year. Led to roughly 350. So if you do what's right for the little guy, which turned out to be an enormous guy in my world, and yeah, it was wonderful. It was very cool. I mean, just follow up, and again, this is an edit job. I went down there to meet with one of their clinics, and I kept contact with my people, and I went into this office, and there were probably it's very it was atypical for an office because the waiting room was jammed. Most waiting rooms are not jammed; they're run well. But these people were the only people getting care in this community. There's 30 or 40 people, patients out the door. This is a big clinic. And so came in and said, "Oh, no, you're too busy." He said, "Oh, no, they closed the clinic and they had this huge buffet lunch of all this culturally appropriate food for their whatever." And it was like unbelievable. It almost made me cry. I mean, so all the doctors, nurse practitioners, staff, it was just like, "Oh, no, this is for you, Mr. Clark." Mr. Clark, God, I'm a sales guy. It just, so I meant a lot to that.
That's amazing. And it has to do with you setting the example, the relationship part that you mentioned. You were giving them the truth. It wasn't like you were trying to go with numbers first and make money. I mean, those all speak pretty highly of who you were as someone that stepped into a doctor's office. Amazing.
Yeah, I wasn't always, I wasn't always that good, but yeah, I was. I think people know. I, I think I give people credit for being able to see who people really are, and I think your employees see that too. And I guess it's a tired phrase, but lead by example. And I would say that the people that worked with me probably knew there was nobody that worked harder.
And then you were mentioning something before the example piece where you cared about the volume of calls and the quality of calls. I'd love to know what the quality of calls meant for you.
Well, just that there was something depth. I mean, you can fake a call sheet pretty easy, like, oh, I contacted 8,000 people, and but if you get down to it, it was like you talk to an answering machine. So, like, what did you talk about? And I don't even care if it was. I mean, of course, you want them to talk about your product,
Yeah.
but if you talk about their kids or their life or what's going on, that that is maybe more important than oh, we can save you $2,000 a year in premium on your malpractice insurance. Wow, that really gets you going, doesn't it?
That sounds so cool to me, even hearing it. That I'm
Well, I
not
know.
even in sales.
But that's the way they, and
Yeah.
that's the reason I quit, because it eventually became just about numbers. But that's because the doctors have already given up making the decision. You've got an administrator at the lowest, likely a CEO now, making that decision. Well, doctors mostly excluded from that.
Why do you think that shift has happened where we don't have doctors in the room anymore and we have more business people talking?
Like, you should talk to patients about that.
Mm-hmm.
Uh, I think it's really boring for doctors to do the numbers,
Mm-hmm.
because they want to just take care of people. They don't really want to worry about, okay, my lease is this much, and I got this HR problem, and oh, we need. I think the mundaneness of that, if they can pass it off to somebody else, then
Mm-hmm.
I I don't I don't have an easy answer to that.
Yeah.
It'll never go back.
Mm-hmm.
And for, just on a personal note, the I used to go to this clinic, and uh, but I went there, and oh, well, we can't do that. That's a separate appointment. Oh, you can't do this. It's another appointment. So I said, well, forget this. I'm going to do concierge medicine. So people that can, which means you're privileged,
Mm-hmm.
pay a ton of money, and they get care. Everybody else has to go through this freaking system that says, oh, you want to get blood work and a physical? Oh, that's two separate appointments. It's ridiculous. And it's costly, time consuming, and not patient friendly. Okay. I'm going off. I'm going, sorry.
You're actually transitioning us to all the right spots. So
Oh, do I
it's,
get paid
it's
extra?
really, you get paid extra. Absolutely. We are talking about pretty important pieces of the puzzle when it comes to medical industry in general. One of them you're going into, and it's immediately taking me into our next question, which is the mistakes. What are some mistakes that you've noticed in this industry?
Uh, well, the biggest mistakes was when doctors let go of control.
Mm. That hit so hard for me just now because um, my sister is a nurse practitioner and she's in the aesthetics world, and one of the things that she continuously tells me is we need to have more doctors in the business room, and we have more business people talking for them. We're the doctors and the nurses, and they should be the ones who are chiming in and talking about patient care. And
100%.
yeah.
And who's talking about patient care are the C-suite boys and girls.
Mhm.
It's so wrong.
Mhm. What are some ways you think that this mistake can be brushed? Because you said this won't change, but are there ways doctors and physicians that are leaders could step in and could make their way into that room?
Well, a lot of medical directors at hospitals, and now it's probably a requirement. Back in the day,
Mhm.
in the 90s and early 2000s, a lot of medical directors had gone to business school, which is a little bit like sleeping with the devil. But at least you have a physician that understands patient care at some point in their life. They actually dealt with patients. I don't know how you get back in the room. I mean, my doctor, the Mr. Concierge guy, he quit the system for the same reason I did. He couldn't take care of his patient. So now he's got a situation. Of course, he's not even making a wrinkle in real healthcare because he's one doctor, and he serves the upper percentile of patients,
Mhm.
which is also wrong, by the way.
Yeah. Do you think, besides having doctors in the room, would it help to bring patients in, or I guess the demographic they're serving?
This sounds really coarse, but I don't think people want. I don't think the people that make decisions want to hear from patients.
Why is that?
Cost. You gotta put a heart back in medicine, and business people are very good about looking at you know profit loss all that stuff, but they're not very good at looking at patients.
Mm-hmm. And looking at the corporate world in general, I'm noticing a lot more of the greed coming in than empathy leaving. I was actually doing a case study with my students in a leadership course that I teach, and we were looking at a merger and acquisition of two hospitals that came together. One was culturally speaking more about greed, and the other one was more about empathy. And the greed took over the empathy. And to your point, you left the position and retired because greed became dominated in your field, and that's what happened in this specific case analysis is people that were in the hospital with empathy started to leave the hospital because of that. When you hear something like that, what comes to your mind?
Duh. Sorry. So who wins in a fight? Does the nice person that's trying to break the fight up win, or does the bully? Unfortunately, and we have great examples currently all over the place where the bullies win. So when the bullies win, the nice people quit. Because at some point, the river's too strong to fight that current. And it's like, forget it, I'm done.
Mhm.
See that a lot. I mean, it it's tough.
How do we change that? How do we make our us as people who have empathy, who want to bring kindness? How do we switch the seat?
I'm a lot better at describing the problem that is obvious than giving the
Yeah.
answer to something that's impossible.
Yeah.
I mean, I look at it as impossible. Not, I should, that's hopeless. And I'm a hopeful guy, and you know that.
I know.
So I shouldn't say it like
For our
that.
listeners who don't know, if you don't know Chris, you don't know Chris, but he's a very hopeful human being and has given so much to the community. So when I heard the hopeless messages,
It's like,
I was thinking, are you serious,
I'm going to take a Prozac real quick.
to your point though, it feels impossible because I think at this point, if I were to put us in the seasons, let's say, as an analogy, I would imagine we're in the winter season of when it comes to corporation. We are in the cold when it comes to kindness, when it comes to empathy, when it comes to emotional intelligence. And we do it feels impossible. I think that's where you're coming in. It feels at this very moment like this cannot be changed. But hope is spring is also around the corner.
Yeah, sure enough.
So how do we get to spring?
I love it when you rephrase the same question that I can't answer. But it sounded different, so I appreciate that. Do you want to go at it one other way?
I mean, you can
Because
do
I,
it
yeah, I know it's good. It's night now, but it's daylight tomorrow. So there is hope, and there are a lot of people in the industry that are on the provider side, which by the way, I hate that term.
Mm-hmm.
I call them doctors. But on the provider side, there are doctors that love their patients, literally love their patients.
Yeah.
And I know that because there's just statistically about 1 to 19 doctors. I'm going to go back to the business part of this so I can get something I know something about. Uh, about 1 in 19 doctors get sued every year. So it's way less than most people think.
Mm-hmm.
Of the cases that go to trial, win about 80 to 90% of them.
Wow.
They're expensive to try, and that's the reason plaintiffs don't want to take it on. first of all, you're going against the bank, the insurance company that's got unending resources. You got an attorney that's hoping to get 40% of any recovery, and they know that their chance of success is between 10 and 20%. That's a high risk thing, and it's not cheap to try these cases. Experts, you can fill in the dots. I was going somewhere with that.
Mm-hmm. So the 1 in 19, you were saying.
Yeah, so the number of lawsuits is way less. So that so when you talk to a doctor, when you used to talk to doctors about their malpractice suit, if you had any kind of actual sharing, they will always bring up their one malpractice case, and it could be literally the dumbest case, but it hurts them. It's shame, it's guilt, it's so even on a case that they win or is dismissed, or just like there's no legs to this. They remember that for their entire life, and it could be like, oh yeah, I remember, 20 years ago, and it's like right there, right now.
That trauma just stays with them.
Yeah,
Mm-hmm.
it it's palpable.
Yeah. And that resonates too because just hearing what, again, the closest person that I have to myself is my nurse practitioner sister.
Yeah.
She even tells me there are times where it doesn't get to a suing point, but if she has any issues with a patient, she carries that home with her. So I can't imagine having a lawsuit that you would carry with you probably until, I don't know, you pass away and you move on from this.
Well, and what's even worse is the the doctor can't talk to anybody about it. I mean, you can talk to your spouse because there's some legal caveat that says pillow talk is okay. So you can talk to your attorney, you can't talk to your colleagues, and all your colleagues probably know about it, but you can't. You just have to sit there and smile, and it's really tough. So our company was very good about that. We did something, and if this is privileged, then go ahead and sue me, doctor's company. But we did something called litigation education insurance, and so we would bring uh, plaintiffs, doctors, and we had a practicing doctor that did led these retreats. So we took the mystery out of what was happening because you put a doctor into a foreign country, which is the courtroom, they have no control and they have no idea what's happening. So we did these litigation education retreats where the doctors learned the system. We did uh, some trial prep. I mean, obviously more generic, but just to see how the plaintiffs might attack them under deposition or under examination. It was very helpful. It was one of our most popular, probably our best marketing thing we ever did. And all it did for us was cost us a bunch of money because we bring defense lawyers, trial consultants,
Yeah.
and the physicians that I mean, I attended some of these, which was unusual, but I'm Mr. Curious here, wanted to learn everything about it I could.
Yeah.
And God, the feedback from those is like, oh, this is the best thing ever. Just like, and I'm sure it changed results for our company. So in the self-interest, a better prepared physician is the likely outcome is much better.
That's that's a very amazing idea. I love that you just prepare doctors so that they don't freeze in the courtroom and
Or say the wrong thing.
yeah, yeah.
Yeah.
Well, as we start to wrap this up, I want to ask you a question for new leaders that are coming in this industry. Do you have any advice for them?
I do. And I mentioned this to you the other day. I kind of cheated because, like, I think you think how you are is one way, and the way you really are is maybe entirely different. So I reached out to a former employee and said, what did I pass on? I think that's your question. What did I pass on to you? It was really funny because the first thing she said, don't check a bag, don't chew gum, always have an agenda. And it was just fun. She said, to this day, I do that. Um, the one thing I'd pass on to like managers and new leaders is just be absolutely grateful. I mean, you're so fortunate to be entrusted with this position. And if you don't think your company is like the best company in the world, then you should leave.
Yeah. Do you think that's because that passion just doesn't die if they think that way and they pursue life that way?
It's a it's almost religious.
Mm.
You know, if you don't have love, it's some sort of clanging bell. I mean, I really believed in our company. I mean, there was no question about who the best malpractice carrier in the United States was. There was zero doubt.
Mhm. And that's really powerful because that's how much love you still have for what you did. That stands out a lot. So thank you.
Yeah, it was a great career. It afforded me so many things, and of course, I made a little bit of money, but for me, it was never about the money. And that, if can I go just a little longer, or is it bad?
No, no, go for it.
Okay,
Yeah.
and so one of the things that allowed me that is I was super fortunate growing up. I had a very good mom and dad, and relatively stable life as a kid. But one thing I would pass on to your folks is have your house in order. And there's some really basic stuff, and when you go to sleep out there, it's fine, but you got to spend less than you earn. Money gives you choices. So I never felt that I was trapped because I had to make money.
Mhm.
It wasn't unending, but money gives you choices. And
Thanks. Yeah, thank you. I appreciate again always honesty and truth from Chris. I always appreciate it. Um, thank you so much for joining us and talking to us. And I want to say last thing because I think listeners will find this really interesting. You're very disciplined too in terms of you've done races like marathons, ultra marathons. I mean, you name it, triathlons. So you know what you're talking about when it comes to working on yourself. I think.
well, thank you.
Maybe that would be another podcast that we can do. We can talk about your life and how you pursued that and how awesome you were with it. Maybe your niece will give a different story, but but thank you so much for joining us today. I really appreciate it.
Thank you.
Yeah. So Integrity Overscale, thank you so much for listening. And remember, live your life in vivo. Thanks so much.